Now we are going to talk about your research project and getting ideas for your project. First, it's important to remember the FINDER criteria. I know that you've reviewed this in previous courses of the clinical research program, but they're extremely important to the development of the research project. First, is the project feasible? Are you going to be able to have the adequate number of subjects, adequate technical expertise to pull this off? Is this project affordable in terms of time and money and manageable in scope? Is the research question interesting to the investigator as well as to the scientific community? Is it novel? Does it confirm or refute previous findings? Does it extend previous findings or provide new findings? Is it ethical? And is it relevant both to the scientific knowledge, to clinical and health policy, and to future research directions? When thinking about research ideas, I recommend that you review prior research project titles that have been part of projects that we've had students do in the past. Identify several therapeutic areas that are of interest to you. If there's an area that you know something about or you have a connection to, it's going to go a long way towards helping you maintain the energy and enthusiasm that you need to get through this process. You could also review abstracts from meetings, such as AACP, ACCP, and ASHP, which are all pharmacy-based organizations, or ASPH, which is American Society of Public Health, or let's say the ADA, or the oncology societies, or infectious disease societies. All of these professional organizations publish abstracts on their website from their annual meetings and other meetings that they have, and this can give you an idea of what other people are doing in the community and just maybe generate some ideas, because usually at the end of every paper or every abstract they will say, this is an area that needs future research. You can also discuss your ideas with other professors or myself, and we are always glad to toss around different research ideas. Now I want to give you some examples of past and ongoing projects. We had one group of students look at predictors of poor outcome among patients with gram-negative surgical site infections in the Duke Infection Control Outreach Network. The DICON Network is a group of folks that I am affiliated with at Duke, and they manage infection control for more than 50 hospitals, I think now, in more than 5 or 6 states, and they're very active. And you might not be aware of this, but hospitals have to have an infection control department or person at their hospital that sort of tracks the number of infections that occur in the hospital, and they report these to agencies like Medicaid and Medicare, and they're used now for payment. And in this case, we had a group of students that looked at an unusual type of infection due to gram-negative organisms in surgical sites after surgery, and this was something that was novel because gram-negative infections are unusual, and therefore it was really interesting, and they did get a poster out of it at a national meeting. We also had a group of students that wanted to look at quality of life in various levels of pharmacy students at Campbell. This was an early project when I first came to Campbell, and the students initially were just sort of upset that the university had instituted a 7 a.m. exam time, and they felt that the 7 a.m. exam times were impacting their stress levels and their quality of life. And they wanted initially to look at GPA, but we do not allow you as a student to look at something that is not a health outcome. We want these projects focused on patients and health outcomes. So we turned around and looked at quality of life using the SFS 36 form, which is a validated instrument to measure quality of life in the health setting. So we administered this quality of life questionnaire to pharmacy students, and they looked at the different levels in P1 versus P2, P3, P4 years, etc. We also had a group of students look at the evaluation of appropriate care of upper respiratory tract infections in the 1999 versus 2002 National Ambulatory Medical Care Survey. I have a separate slideshow or presentation on these national databases, but basically this data is collected by CDC, and it's very large database. And this is a great opportunity to look at something like quality of care measures. And in this case, upper respiratory infections are usually due to viruses, not bacteria, and they should not be being prescribed antibiotics. But this database captures whether or not a patient presenting with this respiratory infection received antibiotics. And so they were able to see the inappropriate prescribing of antibiotics for upper respiratory infections. And did it increase between 1999 and 2002? We had then planned to do like a 10-year study between 2000 and 2010 or 99 and 2009, and we were literally in the works of doing that when someone else published that exact study in JAMA. And so the point that I recommend here is if you have thought of it, someone else probably has thought of it too. So it's a good idea to always go do a lit search for any project idea that you have and make sure that what you're looking at doing is not already published. We had another group of students that looked at the association between female contraceptive use and counseling to deter high-risk behaviors in North Carolina methadone clinics. This is a situation where a student had some affiliation with a methadone clinic and had noted that the women presenting to the clinic were not seeming to be adherent with using contraception. As methadone can lead to birth defects in pregnant women, women presenting to the clinic are of childbearing potential and therefore should be counseled about the need for appropriate contraception if they're going to be taking methadone. So what they wanted to find out is to do a survey in these women to see if women had been counseled appropriately, and if so, or if not, were they using contraceptive measures, and see if there was an association between that counseling and whether or not they were using appropriate contraception. One of the learning points for the students during that project was that they had to enroll patients prospectively, and at the methadone clinics, patients came in very early in the morning at like 7 o'clock, came in, took their methadone, and left as quickly as they possibly could because they had to get kids to daycare and they had to get to work, and they didn't have a lot of time to stand around the clinic to complete a survey for the students. So they had a challenge in enrolling those patients, and I would recommend to you to think about that carefully if you think you're going to engage in a prospective type of study. We had another group that looked at a very large database through vital statistics, looking at the association of education, race, and month that prenatal care began with low birth weight in North Carolina. You might not be aware, if you haven't had children recently, that they are collecting all kinds of data when you deliver a baby in a hospital these days. There is a whole giant data collection form that the mother fills out regarding her health as well as the health of the father, and you can get all kinds of information as part of that. And they track that information in the National Vital Statistics System, and North Carolina also has a cut of that data that's specific to North Carolina. We can get access to that through the Department of Health and Human Services, and we've done projects on vital statistics of birth weight in both North and South Carolina very successfully. The next study was an association between fibromyalgia and bladder inflammation in a cohort of women aged 35 to 74 in a sister study, which was a large multi-center study conducted by the NIEHS. We had a student who just happened to know an investigator there who was an investigator on the original study where they collected all kinds of other information, and she wanted to do a secondary analysis of that existing data, and she got permission from that investigator to use that data set for this analysis. We also had a group of students join me at Duke University Medical Center and look at outcomes of obese patients who were treated with daptomycin. Daptomycin is a gram-positive anti-infective drug, and at the time that we did the study, there was very little data on whether or not you should dose it a certain way in obese patients and whether or not they would respond to therapy the same as non-obese patients, and therefore we examined this. We had another student who worked at an outpatient orthopedic clinic, and at that clinic they did clinical research enrolling patients with knee osteoarthritis. And when they enrolled patients in those trials, they used a tool called the WOMAC scale to gauge the level of pain and function in patients. But there's two scales. One is a visual analog scale and one's a numerical scale. The visual analog scale would be like where patients looked on a line from low pain to high pain with smiley faces and said, yeah, I have a crying face, or no, I have a smiley face. And the numerical rating scale would be rate your pain on a scale of 1 to 10. And a student wondered if one was any more accurate than the other in terms of gauging the level of pain and functionality that patient actually had. So what we did was actually take this to physical therapy clinics that I was affiliated with through another connection in the Raleigh-Durham area. We got IRB approval, and the physical therapists at the clinic who were first evaluating patients with knee pain then administered both of these scales and then gave the data to the students where the students then could analyze whether there was a correlation between the visual analog scale and the numerical rating scale from the physical therapist type of assessment of the patient. Another project that we did with a group of students with me at Duke was mortality among patients with Candida bloodstream infections over a 10-year period. Mortality ranges in the range of 50 to 60% in these patients, and with the new therapies that were approved by the FDA about 5 or 6 years ago, we wondered if there was a dramatic change in the mortality in this population. And so the students did a great project on that, and that again resulted in a national presentation. We also did another DICON-related project at Duke looking at surgical site infections in OBGYN procedures such as C-sections, abdominal hysterectomy, and vaginal hysterectomy. But this is actually centered on community hospitals because very little had been published about this. And this was so novel and exciting that these students got invited to do a platform presentation at an international ID meeting, and it was really exciting for them. We also looked at trends and socio-demographic characteristics of hepatitis C virus-related national ambulatory care visits from 2003 to 2008. This is another example of those large national data sets, and hepatitis C is a hot topic these days, and so that was a really good project. And in North Carolina, we also again worked with the DHHS to look at the outbreaks of pertussis that had been occurring in recent years, and we looked at the incidence of pertussis in various counties and categorized that by urban or rural to see if there was a difference in pertussis incidence from counties of the urban versus rural areas. I will post a list on Blackboard of past projects that you can review, and we also have other ideas that can come from great sites such as Medscape. Medscape has therapeutic area pages for almost all therapeutic areas that you can go to, and they publish and talk about recent research in these areas. I also highly recommend that you sign up for Twitter. If you join Twitter, you can sign up for feeds from journals and websites such as the CDC, New York Times Health, JAMA, New England Journal, and they're constantly putting out ideas and papers and studies that have recently been published. And I also tweet ideas at MDJ690-695 on Twitter to try to give you some ideas that I've seen in the press that you might be able to do a study related to. Another idea to investigate would be to look at PubMed, and there you could search NAMCS or NHAMCS as a database source, or NHIS or any other database, plus the therapeutic area that you're interested in to see what's been previously published from one of those databases in an area that you might be interested in. You could then maybe change the years or change the population or something like that, and that gives you an idea of something that might be feasible. You can also check the National Center of Health Statistics or NCHS website list of publications to see if your idea has already been published from one of these databases, and I have a link to that posted on Blackboard as well. So I hope that helps give you an idea of some of the things that you can do in generating ideas for your project. I recommend that you guys start talking to other people early and thinking about it as soon as you can, and we're here to guide you and help you along the way. Thanks a lot.